An abdominal aortic aneurysm is a blood vessel that's bigger than it should be. So a lot of people have heard about aneurysms affecting any part of the body, such as brain aneurysms. More commonplace that we deal with are abdominal aneurysms, but they can happen also in the chest or actually behind the knee. Any blood vessel can become aneurysmal, which is when the blood vessel dilates and gets bigger than it's supposed to be. Well, this is what is scary about aneurysms in general, is that they do not give a symptom. So they don't cause a scratch or an itch or an ache or any symptom that you can put your finger on. Most of the time, actually almost all of the time, we find an aneurysm accidentally when you go get a test for some other reason. So this is the difficulty in finding the aneurysm before it finds you. There definitely are certain risk factors for aneurysms. There is a familial component, which means that about 25% of the time, if you have a family member in the past who has had an aneurysm, you have about a 1 in 4 chance of having an aneurysm as well. So family history is very important. But aside from that, the same risk factors that affect blockages in blood vessels can also lead to aneurysms. And these include, on the top of the list, smoking, diabetes, high cholesterol, high blood pressure. Those are the big risk factors for aneurysms. If you meet any two of those criteria, we can offer screening for those patients for aneurysmal disease. The great part about screening for aneurysm is that it's simple. It does not require any needles. It does not require anything invasive. Screening for aneurysm is a simple ultrasound. So the worst that might happen is the jelly might be a little cold when they put it on, but basically it's a very simple ultrasound test that we can do for screening. Here at UPMC Pinnacle, we can treat aneurysmal disease along the entire length of the aorta. So we have a very comprehensive program that we can screen, detect, diagnose, and then treat with the latest technology out there. To fix aneurysms typically these days involves a usually less invasive type procedure. It doesn't involve a big open surgery. So we want to find people with aneurysmal disease early, because if you do have a rupture of an aneurysm, usually it's a life-threatening situation. Most of those people don't even make it into the hospital. So the sooner we find the aneurysm, detect it, and come up with a treatment plan, the better it is. This can be a life-saving treatment plan for the patient.